Hello, my name is Jeff with BioRelief.com, and in this video we're going to address some of the ways to remove a male external. Some people have difficulty removing the male external catheter after it's been rolled on. Everybody's skin is a little bit different, so some people might have more difficulty because they have a drier skin base than someone who might have an oilier skin base. Someone who lives in a warm, humid climate, they're going to perspire a lot. That's going to break down the adhesive much quicker, which makes removal much easier. Some people actually don't wear the male external catheter that long. Each catheter is good for about 24 hours, so if you only wear it for a few hours, the adhesive strength is still going to be there. It hasn't worn away that much, so it's going to make it a little bit more difficult for it to remove. But that being the case, we're going to show you a couple of things and give you a couple suggestions on removal. Makes it a little bit easier and show you that it's not that difficult. So obviously the best way we're going to suggest is actually the use of an adhesive wipe. We sell these. They're available in a wet nap form as this is, and it also is available in an aerosol. But there's also a sting-free version, which is what this is, and then there's a sting version, which just means it has alcohol in it. But the best way is to actually try to roll the catheter off first. It should come off very easy. If not, you can use the adhesive remover and just gently work it under the catheter as you roll it off. It's no race here, so you just take your time, and eventually as it gets underneath there, it's going to start wearing away the adhesive, and it's going to make it much easier for you to remove it. Just don't go fast, and once it gets past a certain point, it's going to be able to roll off. And again, just slowly work the here we're using the wet nap. The towelette just generally just nice and easy around the edge there, and it's just going to break it down, and you're going to be able to roll it off very easy. So in addition to the adhesive remover, the wipes and the aerosol that we mentioned, you can also use warm soap and water. So if you have a washcloth, using some warm soapy water, that'll help with the removal process. Anything you can think of when you wear a Band-Aid that breaks down adhesive that way. So something like a skin moisturizer or even baby oil. Once you work that in there, it'll have the same effect. It'll break down that adhesive and make it easy to remove. Another method we can suggest is to take a blunt pair of scissors, and what you would do is at the base of the catheter you would snip it, and that'll allow you to tear it a little bit, and then that way you can peel it away using the methods we mentioned before. You do want to make sure though that before you apply the catheter that you do trim the pubic hair back close as you can so that it doesn't get tangled in the catheter. That will make the removal process a little bit more difficult. So if you would care for any more information on male external catheters and how to use them, please visit our website, BioRelief.com. Thank you.